twice as likely to have diabetes. I would have to say, just based off of the patient population that I've experienced, during my time here in Minnesota in my professional career, and even in residency, we as African Americans will present one for later stages for cancers, more malignant forms of hypertension, uncontrolled diabetes, overweight. There's also some resistance to the whole health culture.
Mental health issues are real, and we have to understand that we can't pray away everything.
Your health transfers over into other parts of your life. If you're sick, you can't go to work. So in terms of the economy, so it's kind of a ripple effect.
These medical inequities are complicated by daunting and convoluted approaches to health insurance.
I have a slight heart murmur, and so it led to me being categorized as uninsurable. I ended up having to pay $800 a month, and with a $6,000 deductible, $3,000 for me and $3,000 for my children. Just the weight of premium and deductible. We have this dark cloud overhead. The pastor is a trusted voice, and so that's why I'm stepping forward. That's why I'm basically sharing my story. And being a pastor, you see what happens to a lot of people who are not insured, young people and old people. Young people are really not thinking through just how important healthcare is and living a healthy lifestyle is.
Healthcare concerns may be far from the minds of many millennials, but feeling invincible can keep some young adults from considering healthcare options.
My generation and the generation after me being accountable to making sure that we are engaging.
We want to know the nuts and bolts behind this. I'm an active member with the Temple of Hip Hop, which is KRS-One's organization.
You gotta keep doing this, yo, okay? We're pursuing this.
I'm one of the official hip-hop cultural specialists that have been directly guided and taught by KRS-One as well as Ministers in Aru. What I do is just looking at everything through a hip-hop lens. I mean, in essence, hip is a form of knowledge. To be hip is to be updated and relevant. Hop is a movement. So hip-hop, in essence, is about intelligent movement. And so we're not just going to blindly follow just because the masses say, hey, go sign up for health care.
Exclusion, discrimination, and the historic trauma that follows have created barriers to black participation in these systems.
Over 200 years of a sort of hesitation towards the government structures and institutions and corporate structures and institutions. So there's a lot of, we don't want to go to the doctor because we don't trust you.
And I think that definitely goes back towards, of course, the Tuskegee experiment. The healthcare system itself, it has created some distrust, and I definitely do understand that.
My parents grew up in the Deep South, in Jackson, Mississippi. When my mother had a toothache, of course, they could not go in the front door. They had to go to the back door. They wouldn't actually feel your tooth. They would actually pull it. And so what it developed in her is this apprehension.
Wow, guys. Welcome to my channel. This is, of course, Queen C. Pinkston, your family caregiver supporter. And we're back here again today with an awesome, interesting topic, guys. And the reason I'm bringing this information, again, is because I do what I do because of what I've been through. You know already, this is my late husband, Ben, 20 years on dialysis, and my late mother, who lived to be 101. So as I was a caregiver for them and went through what I went through as a caregiver, I now can sympathize, empathize, and identify with other caregivers. So I'm bringing some information today. We're talking about healthcare resistance in the Black community, and it can stem from a combination of historical, social, and systemic factors. So we're going to look at another clip, and after we look at this clip, we're going to come back and talk again about it. So let's go out and see can we get it. All right, Let's see here.
Soda. And that kind of
All right, we're gonna
fear,
continue
I
here.
think, is pretty pervasive within the African American community. It's a
Guys,
fear
make
that
sure you
mimics
like, share,
some
and
historical
subscribe.
reality.
And leave a
This
comment.
historical
Leave a
reality
comment.
is that African Americans have been neglected and mistreated by medicine, health insurance, as well.
Healthcare was attended to by veterinarians, not by physicians. So there's been a long, deep distrust of health and the care of our people.
The medical and scientific community supported racist ideology with diagnoses specifically for blacks. Medical science even identified being black as a disorder, calling it negritude.
The slave owners had to justify their treatment of my ancestors by convincing themselves that we were an inferior people. Therefore, denying health care, denying education, denying family, so they could live with themselves.
Following slavery, from Reconstruction through Jim Crow segregation, separate but equal laws perpetuated the unequal access to health care. Some scholars conclude that much of today's health disparities are directly attributable to the slave health deficit and all that followed. But too often the focus is on the problems, pain, and pathos found in African American history. Discovering truth, revealing little-known realities, and surprising stories can offer inspiration and instruction, even in the world of healthcare insurance and other forms of financial self-sufficiency.
You've heard before how we couldn't get pork chops, so we made chitlins a delicacy. Well, in the same vein, we had African American leaders, primarily coming out of our religious community, ministers like Absalom Jones and Richard Allen, who at the end of the 18th century, while we were still struggling with slavery and disconnects of all sorts, created out of their religious fervor mutual aid societies.
Richard Allen, along with a number of other Black Methodist bodies that came together, formed the African Methodist Episcopal Church and incorporated, had our first general conference in 1816. The AME Church, initially started from what we like to consider as the first sit-in Philadelphia in 1787, led by Richard Allen, Absalom Jones, and some worshipers at St. George's Methodist Episcopal Church, where they were not welcome to worship freely. After they completed their prayer, they walked out and they started the Free African Society, which was a benevolent society that was really focused on caring for those that really were having trouble caring for themselves.
The Free African Society's Articles of Incorporation, written in the spring of 1787, called out a concern with health and wellness that resonates across the centuries as they stated, "A society should be formed without regard to religious tenets, provided the persons lived an orderly and sober life, in order to support one another in sickness and for the benefit of their widows and fatherless children."
African Americans pool their funds that we might be able to bury our dead, that we might be able to take care of the widows, that we might be able to provide some health care for the youth.
We can find mutual aid societies providing protection, providing funds for food, for education, libraries, homes that were founded for orphans of color who had nowhere to go, who couldn't be part of orphanages that served white people. All of these sorts of things, as at the same time they were fighting against slavery.
In the very beginning, the black church was everything to the African American. It was a place where we did our theology, of course, our politics. It was our conservatory of music. It was everything for the African-American family and the African-American child.
The gospel of Jesus Christ is about wholeness for people. If you look at Jesus in the Gospels, as the story is told, he's always concerned about the wellness of people. People who were blind, he wanted to have sight. People who were deaf, he wanted them to be able to hear. People who were crippled, he wanted them to be able to walk straight. And people who were even having issues with emotions, he wanted them to be whole, right? And so the church should operate the same way.
The scriptures say that it is the desire of God that we prosper in our health in the same way that our soul would prosper. The holistic kind of philosophy that undergirds the black church comes out of our kind of collective struggle. And so we have to address and have had to address these kinds of issues collectively for some time.
Well, it's an important model because at the time, there was no insurance for black folks.
These historic works of these heroes evolved from mutual aid societies to, as we move further down the line, African-American insurance companies, the Atlanta Lifes, the Golden State Mutuals, the Supreme Life Insurances, the North Carolina Mutuals.
A multi-million-dollar enterprise operated solely by and for Negroes. Inside the home office this morning, switchboard operators, clerks, stenographers, bookkeepers and secretaries prepare for a routine day's work with their usual composed dignity.
These came as responses of a community that was left out, that decided it needed to take care of itself.
Charles Spaulding makes his way through the busy third-floor office to the early struggle of youth, the three white collars, and the day he closed his struggling grocery store to become general manager of Durham's first Negro insurance company, the North Carolina Mutual and Provident Association.
What they did was so much a part of what our people did. Our people have always felt that they needed to lead the way in resolving those problems.
You look back on history and you look back on our ancestors and our current elders and their ability to take ownership of the health of our community, was so powerful.
Cooperatives offered another avenue of economic self-reliance.
We think about slavery as an economic institution. You can see why it would be very easy and seem like common sense to many African Americans to form economic cooperatives that actually go against the grain of that hyper-individualistic, exploitative capitalism, because they and their families and their friends had been debased by that kind of capitalism. And you see figures from Du Bois to Ella Baker to Ida B. Wells and others calling for African Americans to not turn their backs on trying to build wealth, but to do it in a different way, a way that would not be so exploitative. In Oklahoma, this section of Tulsa that had lots of African American owned businesses, and people like to call it the Black Wall Street of the Midwest. Well, Wall Street has this connotation of hyper-capitalism, making money, getting a good return on your investment. But obviously, the people who put together what we call Black Wall Street in hindsight were working together the whole time. It's not that they were trying to leverage futures or something like this. They were bringing people together, creating credit unions, grocery stores, small businesses that they knew people in their neighborhood would frequent, and they also knew were under siege. And unfortunately, in this case, that came true with a white race riot that just completely destroyed that part of town. Many people have started to talk again about the history of the Southern Tenant Farmers Union, which brought sharecroppers together to pool their resources and try to get better ways of selling their crops and getting fair prices, as well as fair rent on the lands that they worked. So these spaces we usually think of as places where people are just hiding and scared and waiting for the civil rights movement decades from now to happen. But actually, If we look at this history very closely, we can see people across the country banding together and trying to make a better life by using these cooperative entities to leverage the power of the group.
The strong history of African American labor unions offers yet another example of effectively engaging in economic systems.
People know what a union is in terms of laborers negotiating with management. However, the Brotherhood of Sleeping Car Porters, which is one of the most important labor organizations founded by African Americans, also had a ladies' auxiliary. And those two organizations, the Brotherhood of Sleeping Car Porters and their ladies' auxiliary, created cooperative economic institutions, including grocery stores and credit unions, to help members and their communities become economically stronger. We don't want to romanticize the kind of self-reliance efforts that occurred during the Jim Crow or slavery past. People making pretty bold statements about how Jim Crow helped keep Black people together. I think that's a very dangerous path to go down. However, I think it is important for us to relearn or learn for the first time a lot of the stories of African American community cooperative economic development.
While African Americans have had to create self-sufficient systems for healthcare since the first decades of nationhood, the broader American journey towards affordable healthcare is a long and difficult one that goes back to the Progressive era.
Remarkable thing about health insurance and the clarity that we've had in these United States about how important healthcare is, we hearken all the way back to Theodore Roosevelt.
In 1909, Roosevelt organized the first White House conference on the health of dependent children. But with the Progressive era fading and with the start of World War I, federal efforts on healthcare faltered.
His cousin later, Franklin Delano Roosevelt, pressed for universal healthcare. He ended up coming away with Social Security.
FDR had to remove healthcare coverage to assure passage of the Social Security Bill in 1935. He tried for healthcare reform again in the late 30s, but the decline of the New Deal and the outbreak of World War II ended these efforts.
Harry Truman pressed for universal health care and was unable to achieve it. Subsequently, we had efforts by Lyndon Johnson and Nixon, William Jefferson Clinton, and Hillary, all to achieve health care. None were able to achieve it. 98 years of struggle in this country towards universal health care was unable to achieve it. So the work of President Obama to bring forward health care is a source of pride for us.
I'm not the first president to take up this cause, but I am determined to be the last.
At the end of the day, no matter what side of the aisle, improving healthcare was important to everyone. It was just how you get there.
And we're going to sign this bill.
More challenges remained after the Affordable Care Act became law. From Supreme Court decisions to the development of the online marketplaces, the process continued to be contentious and controversial.
What we're going to do today is create your account on the Mensure site and complete an application and submit it.
But now it's more about people and less about politics. It's about making sure everyone can access these marketplaces to get the best health care insurance for themselves and their families.
I am Tamika Tody, Mensure Navigator Coordinator for StairStep Foundation.
I was sent a letter to reapply my insurance by computer.
Major's concern was he didn't have access to computer or internet at home. I said, come on in, Major, we'll sit down and we'll take care of this. So in this section, we'll add the other people that are in your household. He had a couple questions along the way, so I was able to answer those questions. We have had some glitches, and the nice thing about the tool is there's so much support. If there's a case where online's not available, we can still do a paper application. So it's really a nice support community. There's always backup. That is the process all done.
All right, thank you very much.
You're welcome. When we're able to see this positive change and see individuals getting their household covered. And it's also nice to see when there's people that might have been paying these huge premiums and deductibles and had these pre-existing issues, seeing them having affordable coverage. It's really nice.
Because you get used to forking out that close to $1,000 a month. And but when the numbers came up, and it was a revelation, and it was a blessing. It was a life changing. I have kids in college, and so 3 in fact, and so those monies can be used elsewhere. So I'm grateful. It's not enough for me to benefit, and I think that the church is an incredible venue or avenue through which this story should be told. That we have a responsibility to empower people, our people, and people in general.
We have been setting up mass community enrollment events in churches. We answer any questions that individuals might have, and then we actually do enrollment right there on site. So we're enrolling people right there at those events.
We hosted one Mentor navigation session after our Sunday worship, where we had several navigators come out and assist folks with getting signed up. And it was an awesome time. And it was good to be able to be involved in helping people get the health care that they need.
Without that trusted voice, we found that in our community, people won't step forward. People won't get engaged. They won't sign up.
Our events are open to the public. They're held in churches around the community, but they're open to the surrounding neighborhoods. So we're reaching everyone. I remember sitting with a white male coming into a little Baptist church, him just kind of looking around at all the children running, and just being amazed and welcomed and helped. I understand the fear that can come along when you don't have coverage for your family. And I understand the bills that can pile up because you're still doing those things that you have to do to protect your family.
We had 2 that were off to college, and we had 3 that remained at home. And we had to make some real decisions because both parents being outside of the house at the exact same time with child care for 3 children becomes a little challenging. And my wife could not, we had to have surgery for her. And I mean major surgery about 8 weeks ago. And in the process of having major surgery about 8 weeks ago, when we first signed up for Mentor, as a man, as a husband, as a father, it was a very proud moment to say, honey, children, we have this insurance, and Dad was able to get this done.
The pride that he can have in signing his family up, especially for the men in the community, to be able to kind of have that as an example and be like, yeah, you know what, that's great. If it worked for him, it'll work for me. We are in 40 years now of hip-hop culture. Really, when it kind of got started, it was all just about the self-expression, self-reliance. But at the same time, now that we're at 40 years, we see a lot of the pioneers of the culture who are aging, who are looking at different health issues. Cool DJ Herc, who is one of the pioneers of the culture, back in 2011, he actually ended up having kidney stones. Of course, no health insurance. This is something now that the masses of the hip-hop community are beginning to start to look at, but they're not going to just sign up blindly. So there has to be an awareness campaign. There has to be some outreach. There has to be community engagement. The Invincibles think they're young and they're going to live forever, and it's just good to inform them of the importance of health insurance and coverage, and you want to have it and not need it versus need it and not have it. It's important to take care of yourself and have access to all of those health resources and do the preventative steps versus the catastrophic care.
There's a writer who said we're all just temporarily able-bodied. And so if we think about healthcare in that way, and we think about preventative care, getting into that system and thinking about yourself as actually doing a social good by being part of a healthcare system is another way of thinking about it.
We can be the model for the nation about how to get health care for everybody and how to get the community healthy.
The reality is we're in this together. This is a life-changing thing, and has been a life-changing thing for a lot of people. And I think ultimately will change the world in which we live.
I think the biggest thing is having the know of who started this process and why it began, and why we have to arrive to this place.
We understand how important healthcare is. If we understand that history of the mutual aid societies and the African American health insurance companies, that we might move from a place of disadvantage to a place of inclusion and respect. I know that Absalom Jones and Richard Allen thrill to think that President Barack Obama thought enough about the importance of universal health care that he staked his entire political capital on achieving it. Glory to God, 2010, he was able to stroke the pen.
Wow, guys. Wow, wow, wow. I'm going to stop it right there on that photo. And I want us to remember that because so often you will hear in the Black community and you hear other communities that, and I'm not here to uplift President Obama, but I just want to share this. You see right there where he's signing the Obamacare, the Affordable Care Act for insurance, the one that they're trying to get rid of. And you see that through the whole video, they're saying prior to that, there were others trying to get that health care affordable, universal, whatever, and none were able to do it, but he did. And it has made a way for many African Americans, as well as many others, to get health care. But we're talking about also, as you heard in the video, why Blacks or African Americans resist maybe healthcare. You heard a young man, even with the hip hop, he said, the Gen X, he said, we got to have some facts behind this. We just can't go because somebody say go, sign up, this type of a thing. But where did some of this start from? So just as a review, as you were hearing, how about historical mistrust? Historical mistrust. And we know this historically, and this is some information that they might try to erase, but they won't be able to erase it because it's real deal. You remember the events like the Tuskegee syphilis study, right? Other unethical medical practices have left a legacy of mistrust toward healthcare institutions. That's what happened at Tuskegee. I don't know if I have something on that. Let me see. Black Americans, okay, in the research, let's see if it says anything here. It says the Tuskegee study is one of the best known. Some Black Americans believe that the healthcare system was designed to hold them back. A 2022 Research Center report found mixed results in how Black adults assess their experiences with healthcare, while nearly half, 47%, said the health outcomes for Black people have improved over the last 20 years. Sizable minorities said they have stayed the same, 31%, or gotten worse. And the majority of Black Americans, 55%, said they have had negative experiences with doctors, including having to speak up to get proper care and feeling like the pain they were experiencing was not taken seriously. Guys, this has been said over and over and over. And I find myself trying to help advocate for young Black women that I know that may be going in for childbirth or something because of some of the recent histories, and like saying to them, you must, if you're having pain, you must speak up, you must let them know. Now remember, I work in medicine, I'm in dialysis. even in dialysis, you have to say sometime to, and not always all Black, but I have to say to them, you got to speak up. You got to let me know if something is hurting you or something is bothering you or something is not right. You can't do that because it has been over the years, not just Tuskegee Institute, but assume that we don't feel pain or we can tolerate pain. You remember back in the movie, it said that the doctors that were used to originally treat us were veterinarians. The doctors that worked on the animals was the doctors that were working on us because they considered us to be less than human. It says in the current survey, 51% of Black Americans say the U.S. healthcare, was designed to, we said that already, to hold back, to hold Black people back a great deal or fair amount. And 28% say it was designed to hold Black people some. And 19% say not too much or not at all. Black adults differ significantly on this question by gender. Indeed, and this is important as well, Black women, 58%, are more likely than men, 44%, to say the healthcare system was designed to hold Black people back. But Black women under 50 years of age, 61%, are much more likely to say this than older Black women, 54%, and all men regardless of age, 44%. So your younger Black women, you're dealing with a lot of female issues, right? And so therefore, you're going in and be it childbirth, be it you're having tumors, fibroid tumors, you're having something dealing with your ovaries, something is happening and you're experiencing severe excruciating pain, and it might not always be in the female area either. So now you're having the doctor saying, well, we'll try this, try that. It might not, they don't take you too seriously, or they want you to take something over the counter or something of this sort. So you're coming away thinking they don't really listen to me. They don't really either understand me and they don't take me seriously. And you're feeling your needs are not being met. And this is real. So this is a caregiver podcast. And you will say, well, how does this affect caregivers all over the place? All over the place. It affects you and you going in to do life care, self-care for yourself. It affects your loved one, your mom, your husband, or whomever you're taking in to receive care. Because first of all, coming from this age range and knowing about Tuskegee and other areas, they might say, no, I don't want to do that. I don't think I need to care. My mom used to say, no, I don't think I need to go. Because they felt more comfortable in trying to find ways to handle it themselves through either herbal teas or things of the sort, because they did not trust the doctors because of the history. Okay? All right. Another one around mental health. Mental health issues are often stigmatized, with individuals being encouraged to rely on faith or family support rather than seeking professional help. So this is a stickler here. This is a stickler here. Being in the ministry, being a devout believer in God, and totally believe in healing without any shadow of a doubt? For some, this can be a stickler. How can it be? Because you put God in a box and you don't really have a balance. And I was once way over here, and then I was once way over there, and then I had to get a balance. So as we read in the scriptures, we'll find out Jesus healed a variety of ways. There were times that he would speak, we call send the word, and the person would be healed. There would be times that he would, once he spat on the ground and made it like a ointment of some sort and placed it on the guy's eyes. There was a time that he went to the leopard camp, and when the leopards were quarantined and no one could go near them, he defied that and he went and touched the leper. So when we have issues, be it mental, physical, that we're dealing with, if we try and put God into a box and say, no, he can only heal by the laying on of hands, he can only heal by this or by that, then we're putting him into a box, but we have to allow the Lord to be free. So if he uses a professional, that does not mean that you don't have faith. That means that you pray and you have faith that God will use that professional properly, that professional will do what that professional knows to do, regardless of your skin color. That's where we stand in that place. We get the scripture and we stand on the word of God and we say, God, we know that you can heal. We know that you can deliver. And God, I believe and trust in you that as I go to this doctor, you're going to protect me. And that doctor is going to do what they know is right. He's not going to give me the wrong medication. He's not going to say that I don't feel this. He's not going to say it's in my head. He's going to do what he know is right. And I'm trusting in God that this will take place. Because there are some things that people do go to the doctor for. And if you allow yourself to be, as a Christian, as a follower of Jesus Christ's teachings, I'm careful on saying Christian because there's a lot of people now that are professing to be Christian and they're far away from the teachings of Christ. Far away from the teachings of Christ. So I'm a little leery about that right now in this day and age. So I'm a follower of the teachings of Christ. So I'll say it that way. Okay. So as we were saying, that the resistance in the Black community to mental health services. So the question here is, say, what causes resistance in the Black community to mental health services? And they gave 2 points. 2 common phrases are used to describe the resistance to mental health in the Black community. These phrases may be inaccurate. It says Black women weigh in on what is truly the problem with seeking mental health care in the Black community. So I'm wondering here, it says, in my clinical experience, I frequently listen to comments from other mental health professionals and agencies and representatives about why the Black community often seem to fail or often seems to fail to seek mental health diagnosis, treatment, and services. 2 phrases commonly used to justify it. So I want to see what those are. What are those phrases? Okay. It says, 1, there's a stigma in the Black community concerning mental health services. Okay, there is. And number 2, Black people do not seek mental health care. Now that is a known fact. That is a stigma that has been going on for years. It was in the culture, you just don't seek mental health care. All right. You battle with it. Remember, I shared with you in my community there was a gentleman that had issues for years. Now that I'm in medicine and I kind of look back on what he was doing and how things were going, there's a few things that could have happened. He could have been schizophrenic, he could have had Alzheimer's, he could have had some things going on. But because of the culture back in the day, you kind of just didn't. You kind of tolerated whatever he was doing. You let him do it. He'll get all right. Every so often he breaks off and do these things. He'll be okay. Yeah, it was kind of that way. Or, we're just praying about it, right? So as this group of Black women answered my question, I realized one problem is that mental health professionals missed the opportunity to ask the Black community about their perceived resistance. Asking this group their thoughts open up a wealth of information. So it would probably be like, what is it? Why? Okay? What is going on? Why do you feel this way? What is happening here? Right? What are the barriers? What's happening? So these are some thoughts with mental health. So now, again, we're talking about in the Black community resisting healthcare. And we're saying that these things stem from a way back, that mistrust is the biggest. Because that's what they were doing. And they're still doing it in certain areas. Now, we might not be treated by veterinarians, thank God for that. But you might not still be receiving the best of care. That's why we were sharing that sometimes we need to make sure that we have a cultural professional, someone that maybe identifies or understands our culture and can help us. I'm not saying that all melanin people understand all melanin people culture, no. But that's where research come in. And that's where when you're talking to your physicians, because my physician is not Black, but my physician understands, and I have a great relationship with my physician, and she listens and she understands the culture. She's not she's of a different culture, but she can relate and she understands. And you got to do that. You got to research. You got to ask questions. You gotta be that advocate for that loved one and for yourself. Barriers. So let's see, economic instability. You remember the father was talking about he and the wife both worked. They had 2 kids in college, 3 at home. The economic instability, the lack of insurance, and the underrepresentation of Black healthcare professionals contribute to disparities in care. So now, a lack of insurance is huge. He mentioned some Black insurance companies that started up, and I was trying to recognize some of the names. I can remember in South Georgia, we had a company called Independent Life, and I think it was Gulf Life. We had Gulf Life and Independent Life Insurance. Now, those were life insurances. And as a child, I didn't fully understand, but I knew my mom would make sure that she would always pay whatever it was, save up to pay that life insurance every month. Life insurance was for a burial. And no matter how long she would have that insurance, she would only receive $1,000 at burial. Because it was not whole life, just $1,000 at burial. And no matter how many years you pay into it, you only receive $1,000. That was one insurance company, those 2 insurance companies, Independent Life, Gulf Life. If you remember anything like that from your parents or anybody ever talked about something, leave a comment. Leave a comment about that. Or if you have thoughts about Obama, positive or negative, in him signing the Obamacare, the Affordable Care Act, which is the same thing, leave a comment. Leave a comment. Okay. So the barriers to healthcare could be what? Economic instability, if you don't have insurance, and underrepresentation of Black health. Your doctor is not really diagnosing you properly. And yeah. Now, we're talking about 11 conditions that proportionally affect Black people. It says Black people in the United States are more likely to develop certain conditions or have worse outcomes from those conditions. The reasons for this are often some combination of genetic, social, and economic factors. Um, Let me see if they give it a full list because I won't be able to do them all here at this time. So we're looking at, we already know heart disease. We know that there's obesity. See if I can go down the list here. Obesity, okay? So just real quick, Black adults in the United States are 30% more likely to have obesity than white adults. This disparity is even greater for children and teens, 50%, and women, 50%. Obesity is a risk factor for several conditions on this list and can contribute to worse outcomes of other conditions. So this is something that some of these things we can work against. We can change in our lives, right? Um, Unless obesity is hereditary. Some things we can change. Diabetes, okay? Black adults in the United States are twice as likely as white adults to develop type 2 diabetes. That's why that's when type 2 diabetes is when your body can't produce enough insulin to keep the blood sugar levels down. All right. We have to watch what we eat. We have to, guys, there's some things we got to do. We have to do them, right? We have to watch our sugar level. People say to me a lot of times, I made it upon myself because my doctor she said to me, and I guess I could be considered obese for my size because you're supposed to have your BMI is like 30, at least 30, waistline 30. So if you're like 31, 32, and by their measurement, you're considered, okay, obese or overweight or whatever the case may be. So it's the gut thing is what's going on. So then if you see pre-diabetic or your A1C is really up as you get it taken, your fasting A1C, that's checking your blood sugar, then we might have to do something. So I started watching my sugar level. So I get my sugar basically from my fruit in various things, okay? Instead of just buying bags of sugar and ducking in my coffee, ducking. Just a thought, okay? So it says here that we are twice as likely, Black adults, right? Now, complications from diabetes. So if we're obese and now we're diabetic, so what are the complications? Some of them is like kidney disease are also more common among Blacks, right? So we have to be careful with that because one thing leads to another. One thing leads to another. High blood pressure, okay? And that's hereditary, that's handed down in my family. And so I have to be aware of it. Now, I started out as a kid being hypo, and had low blood pressure all the way until I became an adult. Well, after taking care of the stress level, taking care of my husband right here and my mom on here, doing my health care through those years. Stress can cause havoc on your blood pressure. And a lot of times you don't show it on the outside. It can be internal stress. Okay. You handle things from the inside. You might not be a type A behavior, but you're working on things inside. So stress level. So stress. And then of course, if it's hereditary, and then of course, diet, eating tons and tons and tons of salty food and things of that sort. And we know that we have to be honest, in the Black community, we do like our food definitely seasoned. We don't like it fresh at all. So, according to the American Heart Association, 55% of Black adults in the United States have high blood pressure. 55% according to the American Heart Association. So that's one of the highest rates in the world It says if you're Black, it's also more likely to affect you earlier in life. Than it affects white people. The American Heart Association lists obesity and diabetes as two major factors. But I just said it, stress. And this is where we are today, people, and we got to watch it. Racial discrimination, it might also play a part. No, it doesn't. It does, because it raises your stress level. It gives you more and more and more to be concerned about. You fighting with race issues in your school, on the job, in the stores, in your neighborhood, where you live, just everything. So that raises, yes, yes, yes. The same steps you take to control others. Also, they give us some steps on what you can do here. Let me move to another one real quick. Stroke. Now, a stroke occurs when enough blood can't get to the brain. There's a blockage, a clot, something, okay? Usually due to an artery being blocked. As with other conditions relating to cardiovascular health, Black adults in the United States are more likely to have strokes and more likely to die from them. Guys, high blood pressure and diabetes are major risk factors for stroke. But so are what? High cholesterol, and there's that S word again, stress. And here's another S word, smoking. A heart healthy lifestyle can also, so there's a lot of things that we can do with to help ourselves with these with these conditions, and helping ourselves maybe not have to be at the doctor's office so often, because we don't want to be there anyway, because we're definitely not trusting, but we know we need to maintain our health. So we got to be wise, we got to be an advocate for ourselves, and we got to be an advocate for our loved one caregivers. I'm talking to you now, okay? There's another one called sickle cell anemia, SCA. So it's a rare genetic disease that affects the hemoglobin in your red blood cells. The hemoglobin, you've heard that word. It affects how much oxygen your red blood cells can deliver to your organs and tissues. So, while only 1 in every 1,600 Hispanic babies is born with sickle cell anemia, the condition affects 1 in every, hear this, 365 Black newborns. In every 365 is what they found. And about 1 in every 13 Black babies carry the gene and can pass it on in the next generation. But the disparities in healthcare access and quality can also affect people with the SCA. Many have trouble obtaining pain medications. Here we go again. Okay, that they need to manage their condition because of racist beliefs about Black people's perception of pain or concerns over opioid misuse. So you won't get it because you're thinking you're going to overdose, or you're a drug addict. You entered in, you're saying you have pain, but you really don't have pain. You just need something because you want drug medication, but you are in severe pain. Who's going to believe you? And this happens a lot. Now, the other side of it, it can be very, very, very true, because we've seen that as well, that people are lying and they just want something to get high off of, and they're faking the pain. How are you going to know? As a professional in medicine, how are you going to know? There's got to be some guidelines, but you got to know you can't just deny everybody because some people are really in pain and they are really, 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 really hurting. And people have died sometimes because they didn't get the medication that they needed because of their racist beliefs that it's just a black person pretending that they're hurting, pretending that they're sick and they don't have pain. You got to have an advocate. Out of the mouth of two or three, the word of God says, let everything be established. So you need a witness. You need somebody to say, no, 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 no. This is not drugs. No, no. She's in pain and she needs something real to help her or him. So it says, yes, because of racist beliefs about black people's perception of pain or concerns over opiate misuse, the SCA is a lifelong condition with symptoms starting in childhood. Finding a culturally competent, again, you got to get somebody who understands that this happens in 1 in every 365 babies, and this is real, and you're not faking it. You need a culturally competent doctor who understands the impact of the disease on the black families and can make a big difference. Caregivers, you got to be an advocate. Cancer, another one. According to American Cancer Society, black people in the United States have higher death rates and shorter survival rates than any other racial group for most cancers. So what are some of those cancers real quick? We got breast cancer. Black women is 41% more likely to die from breast cancer than white women. Yeah, prostate cancer. Black men are 73% more likely to develop prostate cancer than white men and are twice as likely to die of it. Colorectal cancer. Largely due to disparities in screening, black people are 20% more likely to develop colorectal cancer. This disparity only developed in the last 30 years, they said. Lung cancer, black men are 12% more likely to develop with lung cancer, to be diagnosed, with lung cancer than white men. Both black men and women are more likely to be diagnosed younger. Multiple myeloma. This blood cancer is twice as common in black people than in white people. So there's tons and tons and tons, it seems, of diseases. And of course, I'm going to end with kidney disease. Kidney disease. Not the last one, because of time, I'm going to end the video with kidney disease. So according to the National Kidney Foundation, black people in the United States are more than 3 times as likely as white people to have kidney failure. They attribute this to higher rates of risk factors in people of color. Such risk factors include diabetes, we just talked about, obesity, and high blood pressure. Those 3 main things are devastating. Doctors use a test called the estimated glomerular filtration. They call it EGF rate. The EGF rate. The EGFR rate. The EGFR rate. Okay? So they'll say, what are you doing? I'm doing the estimated glomerular filtration rate, the EGFR test, to assess your kidney function. So if they say that, that's not what you're talking about. But the test is often, this test often estimates black people as having higher kidney function than they actually do. This can delay detection and treatment. So if that test is not proper, and we talk about that in another one of our videos, then you can not even be told that you need to get treatment. It can be delayed. So the National Kidney Foundation has eliminated this calculation and is working to ensure that labs across the country follow suit. So now if you have somebody doing this test, so you might say, I need another test because they found out that this test is not accurate on black people. The key to management is early detection, but because a higher percentage of people of color are uninsured, So now Medicaid, Medicare, your own private insurance, whatever you have, you're uninsured or lack quality health care access, right? Many do not detect kidney disease until its later stages. Guys, we're going to stop the video here with Obama signing the Obamacare Act, the Affordable Care Act. And I pray that you got something out of this video. I pray that you be encouraged. I'm going to leave you a couple seconds with my hymn for today. Jesus is all the world to me. He's my life, my joy, my all. He is my strength from day to day. And without him, I would fall. When I'm sad, to him I go. Oh my God. Guys, make sure that no other, let me turn the page on this hymn. No other one can cheer me so. When I am sad, he makes me glad. Glad. He's my friend. I pray that you be blessed today, every caregiver around the world. And remember, Jesus is your friend, and so am I. Make sure you like this video. Share this video. Guys, share it. There's people that need to hear it. We're going to see you right here in our next video.